So now we move further. Our next session is Dr. Manoj Patel sir. With a big round of applause, please welcome sir.
કેમ છો રાજકોટ? I think I'm very lucky that we had a very energetic performance, and in psychiatry we call it never talk of progress all the time. There is a scope for regression. Eat, drink and be merry is equally important. Otherwise, all the time when you study, probably you will go mad. So I think this is a very good performance. Big round of applause to all the students. Friends, I am extremely thankful to Dr. Kalpit and team for this invitation. This is small aspect of something which I am working on it since last 15 years. I am extremely thankful to my teachers from Dr. Dowde Institute and the entire team who has given me opportunity to deep dive into one of the most challenging aspects of human health is mental health. And friends, you will be surprised that the treatment of psychiatry which Master Hahnemann witnessed in his internship was one of the reasons why he left allopathic practice. And he decided that I have to do something for humanity. It was a very crude, very harsh treatment which was going on. And this has touched him when he was intern. So how many of you are intern? Please raise your hand. Internship. Lovely. Great. This is the most important part because there where you will ask maximum question. Now you are passed. There is no question of pass and fail. You try to ask question which Hahnemann also used to ask. Never accept homeopathy straight away unless you see the result. So I'll try to bring, like in morning sir said, Tarkeswar Jain sir has said that bring classroom to clinic. Yes, this is very important. But I'll also say that bring clinic to classroom. Because clinic will give you some extraordinary experience which sometimes is not taught in classroom. So we'll explore that. It's not moving. Yes. So these two people have influenced me the most. Master Hahnemann and his work. More and more I go in detail and I find amused. Specifically his aphorisms from 210 to 230 on psychiatry. And my teacher, late Dr. M.L. Dowde sir, both were very strong on attending OPD from first year. When we started our college in Sumeru also, first year onward we started experimenting out. And as Jain sir has said, it's very important. First year onward, just go for survey. Survey into village nearby and you will be surprised to understand what is the scenario of health in India. You don't need to go to OPD first. Go to community. Go and relate to them. And you will find that so many cases which are not attended to. And they are willing to take treatment under you. So you can connect to patient and your empathy will lead them to homeopathy. So we created Anukampa ward and we strongly believe that patient is the teacher. Each case teaches you, like Hahnemann has gone through an experience of treating patient and then he revising himself, treating patient and revising himself 5 times in the 6th edition. So 6th edition is a proof that he was actively involved in his practice and he was changing his perception, his ideas about homeopathy, and he went on improving till his last breath. So this is what homeopathy is. So patient teaches us various basic philosophical aspect, clinical aspect. It makes you better educationist. Psychological dimension improves when you try to see patient with empathy and when your knowledge expands through research. We are going to witness one of the finest person I like, Dr. Girish Gupta sir is here, deeply involved into research and again clinical research, not just theoretical research. So these are the process which evolves your real state of unprejudiced observer. And then finally, spiritual dimension, friends. Each case, each patient, don't think you are doctor and they are patient, because we are patient first. And this patient within us gets healed while you heal others. So you are first healer and you evolve as a homeopath. Because healing is possible even with little knowledge of homeopathy. Friends, you will be surprised, when I was just in 11th and 10th standard, luckily I had a neighbor who was homeopath, lay homeopath, and I was practicing homeopathy from 12th standard. So first I was seeing patient, then I understood and went to college. I had patients every Sunday, at least 20-25 poor patients used to come to me. I used to practice pendulum. Take hand of the patient. See, it was a game for me. Finding out remedy through radiesthesia, and then finding out some remedy and giving them and feeling better. So out of 5, 6, they were feeling better, and then I started feeling, yes, I can do something. So friends, there are n number and thousands of patients are still multiplied by 100 homeopaths are less for India. There is no dearth of patients. There is immense number of work for you. Only change your attitude. And that attitude is of care and compassion and anukampa. So we will travel through this journey. And friend, another dimension. We may become researchists, we may become educationists, we may become only clinician. But homeopathy is a science where each case is research. So patient care is inbuilt with research. And each homeopath is a good teacher. And all these three dimensions was part of Hahnemann's life. He was a good clinician, good researchist, and great educationist. So you cannot segregate it out. For some purpose you develop one of the faculty. That's why each teacher must practice. Each teacher must write research paper. You see, the homeopath within you will develop like no one's business. So I have written a little poetically, a homeopath is not a fragment, but a circle drawn in care. Science in the mind, story in the voice, compassion in the heart, and healing in the hands. So what is qualitative research? There are two types of research. Many a time which we know is a paper of quantitative. How many patients came, number, data, rates, level, value, statistics. While another research is now accepted very well, and that is in modern field of psychiatry, is called qualitative research. Because you can't go to laboratory for psychiatric cases. You need to have qualitative study. So what is qualitative study is, how does patient experience the illness? We have a name of the illness, but the experience of each illness of each patient is different. And this experience you have to capture. This will give you fairly good idea about homeopathic remedy and will be useful in your research. What meaning does disease have in their life? How does socio-cultural family situation? You will see the case which I have brought. And anyone who is looking into this camera, please, video of my patient will not be published on website. So if you have a live presentation, please stop that when I am showing video. કારણ કે આ વિડીયો પ્લીઝ બધાને બી રિક્વેસ્ટ છે ઓનલી ફોર એજ્યુકેશન એન્ડ રિસર્ચ પર્પઝ આઈ હેવ ગોટ પરમિશન એન્ડ નોટ ફોર એની પબ્લિકેશન ઓર શોઈંગ ટુ એનીવન એલ્સ. So why do patients adhere and sometimes they drop the treatment? So this question of why and how is qualitative aspect. So we'll travel into the case. She is a girl, lady, 22 year, coming basically from Nepal, and she was married, and she has from Nepal came to slums of Bombay, almost chawl type thing in outskirts of Bombay she is staying. Friend, please, when I'm saying empathy, travel with the patient. You're staying in mountains, hills, and now you are straight into chawl of Bombay where there are hundreds and thousands of people. Why I'm saying listen to this carefully, because genesis of psychiatry has so many components. Family history, cultural history, migration history, then psychological impact on them, and then finally various aspects of sociology. So biopsychosocial, all the three dimensions are important in each case. And this, you will, moment you listen to this, you will realize that all the three components are involved. And that's why in Hahnemann, in his fifth aphorism says, I want you to study all the three dimensions. And then only case is complete. So husband was not accompanying her. Her brother-in-law was with her. There were burn marks on her face, on her hand. And she was unable to communicate with us. She was running in the ward. I will show you the video. We couldn't talk to her. She was there in our hospital for 1.5 days. Then I got involved. Before that, resident doctor were treating her. And no one can go and approach her. Please note down. It will help you to prescribe. But simultaneously, she was saying that she is pregnant. All these components should alert you. So when you screen the patient, don't straight away jump to homeopathic totality or homeopathic remedy. You may start thinking about it, but medico-legal aspect is very important in female 22 who says that she is pregnant, there are burn marks on her face. Be careful. Is there any assault on her? And you straight away taking up without clearance of medico-legality is not good. So even in your OPD, if patient comes, you may take the details, but send them for checkup. Are you with me? Awake? Lovely. So gynecological examination has taken place. She was in OPD. We transferred her to IPD. She was admitted. Gynecologist checked her and there was no pregnancy. And because of uncontrolled excitement, people couldn't control, so they took her to Bhagat, and Bhagat gave that mark so that she calms down. So this was the crude treatment, not only in Hahnemann's time. This is going on till today. Even if you take allopathic drugs, sometimes they make you sleep. It is internal chain, chemical chain. There was chain outside you, now chemical chain inside you. So that you don't think, you don't become excited, and you just sleep more. So there is no major change. Shift is only model of treatment, from crude physical treatment to chemical treatment. So please be connected and see what happens. She was talking irrelevant, sleep loss, appetite. Since last 6 days she is into loss of appetite state. Not when you offer food she was not taking. She goes out of house. Husband बोलता है कि वो भाग जाती थी, कपड़ा फाड़ती थी और रात को रोड पर चली जाती थी. Homeopathically be alert. There is a rubric for this. Trying to remove her clothes, be aggressive, violent, but not violent to others, but as much as she was making anger on herself or someone who is approaching. So this is our IPD setup. We gave name, no psychiatry ward, nothing. We say Anukampa ward. So when we use code name Anukampa, people know where is she admitted. Just observe. वीडियो बंद।
क्या चाहिए तुझको? अरे क्या चाहिए बोल, मैं तो उठे रहती हूँ, क्या चाहिए? अरे सिर्फ मैं तो बोलेगी ताकि लगता मैंने देखा ही नहीं कुछ को आज करती रही। बैठना इधर 2 मिनट बात करते अपन, बैठ इधर। अरे बैठना तो चेयर पे बैठ, बैठना 2 मिनट तो बैठ, बैठ। कितनी अच्छी है देख, कितने प्यार से बैठेगी ना, ये क्या, बैठ बैठ, ऐसे ऐसे करेगी, बैठ, हाँ अच्छे से बैठना। क्या हुआ ये, क्या है ये? भागना ना धीरे धीरे धीरे।
Everything you observed? Will you take this case? Yes, sir. केस लोगे अब? मस्त हाथ लगा विवेकानंद। आप लेंगे कि नहीं? स्कोप एंड लिमिटेशन टेस्ट करने का ना, आपकी ओपीडी में आया तो आप लोगे नहीं। इट्स वेरी डिफिकल्ट टू ट्रीट हर इन ओपीडी लेवल। यू नीड आईपीडी, सो यू नीड गुड कनेक्शन वेयर person is ready to admit these people. And if not, if you are treating them at home, see that they are not harmed. This is our newly constructed ward. She is the second patient right now. So all ward is empty. नया cots थे, हमें भी learning हो रहा था। हमने पंखा नहीं रखा था so that they don't hang themselves. हमने जाली अलग दूर से रखी है so that we have created guidelines as Hahnemann said. Don't keep anything which is harms patient. But हमें ये ध्यान में नहीं है कि खाट की रीम can also harm. Because she is not been able to take care of herself. She is not into herself. Disintegrated self she is. So whether we take such case or not, our champion is Master Hahnemann. अगर हैनेमन ने ऑर्गेनोन में नहीं लिखा होता तो शायद मैं भी नहीं लेता था। हैनेमन ने नॉलेज कहां से पाया? Very interesting story. His entire aphorisms are full. 210 to 230 is full of psychiatry. Many a time in college days we used to keep it only for short notes. Psychotic expressions क्या होते हैं, schizophrenia क्या है, थोड़ा मालूम है, and 2:10 से 2:30 को हम attend ही नहीं करते थे. But that is exactly where we were faltering. It's very important to study this aphorism where he has given clear-cut guidelines of psychosomatic, somatopsychic, one-sided disease, how to treat, and friends, you will be surprised. Out of 4 patients visiting my clinic today, 3 needs help of psychologist. Be mind what I'm saying, where mind is stressed. Out of 4, 3 people. And out of every 4 family members, 4 houses, family houses, there is 1 person needs psychiatrist. So there are lakhs and lakhs of psychiatric patients. Hardly any asylum. If you walk through any street, हर एक स्ट्रीट के कॉर्नर पर एक कार्डियोलॉजी सेंटर होगा, नर्सिंग होम होगा। आपने साइकियाट्री सेंटर देखा है कहीं? So it is very important. Most of them are at home. And one psychiatric patient can disturb so many people because most of us are borderline cases. Most of us have some stress, anxiety, and we can't handle the situation. So this is current reality. And if homeopath knows how to handle this, can you understand how many patients you will be trying to visit to you if you have knowledge of fundamental of psychology and applied psychology to psychiatry, into mental health. Pure psychiatric case, leave aside, schizophrenia or what I am showing you, a disturbed case. But if we can help her, we can help anyone. Are you with me? I am not expecting that you start seeing such cases. But if you can help her in acute, you can help simple anxiety, simple low mood, may not major depression, may not be so schizophrenia, but they are very few in number. Most of the cases are full of low mood, anxieties, OCDs. So Hahnemann got this knowledge because he was so passionate that community comes and helps you. The Duke has gifted him this castle. In this castle, he admitted patient from 1792 to 1793. He started gaining knowledge of mental health. And in this particular patient, Kokenbar, there was bad, worst case, like what I am showing you, usse bhi kharab state mein tha. And he could see that homeopathy worked on that cases. And he has written 210 to 230 aphorism after this detailed study. After this, there is a revolution came. Very few people are. How many bed hospital homeopaths were managing psychiatric hospital, do you know? Anyone has a guesswork? 30 bed, 40 bed, 100 bed? I'll show you the picture. कितना नंबर है? 3,686 bed homeopathic mental health hospital. Where? United States of America. Up to 1960. Are you with me? Till the chemical reactions and chemical pharmacology came. And what was the secret? How many units were there? 100 buildings were managed. These are real photos. And this was the secret. How we were different. Hahnemann said, treat them compassionately. Treat them as a human being, not like an animal. So there was a baseball team. And our homeopathic resident doctors and the superintendent, they used to take them to play baseball. All their aggressions and anxieties were channelized. To an extent, they defeated the state level team. And it became the flash news that homeopathic mental hospital team defeated the New Jersey team. And this was a remarkable reason why it became so popular also. The most important aspect is mental status examination. Now come back to case again. This is the tool only psychiatrists को नहीं use करना है. Every homeopath must learn this tool. Like you learn to examine your physiology, blood pressure, all your physical examinations, neurological examination, add to your list mental status examination. Friends, these are the key points: appearance, behavior, various types of thought, speech, perception, mood, memory, and insight. You will be surprised that under appearance, there are more than hundreds rubric. Under speech, different type of speech. Just open up synthesis or Kant's repertory. How many rubrics are there? Are we using it? We are not. So mental status examination is useful to every homeopath. And this will give you clinical diagnosis and this will give you qualitative practice of homeopathy. So go back to case again in detail. Patient was married since 1.5 years, lived in Nepal, and marriage was also in a peculiar way. There was a big earthquake in Nepal. Are you aware about it? Massive earthquake. She lost her home, she lost her close relative, and within few months, family felt that इसका शादी करवा लो. तो इन बॉम्बे से सिंपैथेटिकली लोग गए हो गए, वो नेपाली फैमिली में उसकी शादी हो गई. Now just be with this girl of 22, innocent girl, at that time of 20, is now straight away married after trauma. She is already going through grief, sadness, घर चला गया. Or so marriage becomes sometimes solution to the problem, right? They are never. I always say marriage is a new problem. I wanted, सो रहे नहीं सो रहे हो ना. It's a sweet problem which we take in our hand. लोग ना बोलेगे तो भी. લગ્નના લાડવા ખબર છે ને, સાબુદ્દીનના, ખાવ તો એ પ્રોબ્લેમ ને ન ખાવ તો એ પ્રોબ્લેમ. So she's been married and this is how the stress starts. She's feeling alone, husband is going for work. So due to delay in menses, she went on feeling pregnant. Now you understand value of why she is so desperate about pregnant. Can someone tell me what is pregnancy to her? Pregnancy means कोई मेरा है अपना. Are you with me? घर छोड़ के आइए, सब लोग को छोड़ के आइए, नया आदमी के साथ रह रही है और उसमें भी वो कनेक्टिविटी नहीं है. तो फॉर हर शी इज सो डेस्परेट दैट शी इज ऑलरेडी डिल्यूडिंग एज इफ शी इज प्रेग्नेंट. So she became so desperate, then came to know that there is no pregnancy, bleeding ho gaya, menses ho gaya, and suddenly breakdown started. And this breakdown led to her very weird behavior, and this behavior led her to take to various doctors. The husband will tell you the story in a brief. And then they ultimately took her to Bhagat. And after going to Bhagat, she furthermore deteriorated. And then she comes to us. This condition in psychiatry called brief psychotic disorder. This is within the 1 month, so we cannot label her as any other, but brief psychotic breakdown. And this breakdown is in the scope of homeopathy to treat if you have correct remedy. There is a lot of self-disorganization, delusion, and grossly disorganized catatonic behavior. So what is the theme of the case? Belongingness and alienation. She belonged to something, but she was alienated. Another is betrayal and forsaken. Please, friend, when I am saying qualitative research means each case has theme. Capture this theme of the case. And I'll tell you, Materia Medica, you will go, there is a theme. So if you have a thematic understanding of Materia Medica, thematic understanding of case, your similarity becomes easy. Betrayal and forsaken. She is denying her pregnancy once this has happened. So there was a lot of forsaken and lonely feeling. Trauma and fear was in background, and now with this Bhagat treatment, she became more traumatic and disintegrated self. This is the 4 stages which we are seeing in this case. So remedy? Fast. Viretrum was already given by student for 1.5 days with delusion pregnancy. But how do you differentiate Viretrum? Any other remedy, please? She runs at night like a run amok. कपड़ा फाड़ देती है. HomoeoSeminar और एक रेमेडी बच गई ट्रायो की. डरती है, फ्राइट, फियर. Lovely. Stramonium. So these are the remedies which you will study in psychiatry. These are 4-5 remedies. Very useful, Hahnemann says. In his aphorism, he says that first phase you will need this remedy because this is latent sora. It's an explosion of latent sora. And once it is settled down, follow it with deep acting constitutional remedy. So this is a strategy of psychiatric treatment. I don't want to make it complicated because it is not so complicated. Hahnemann has given clear-cut guidelines. So fear, fright, delusion, she is pregnant, tearing clothes, restlessness, throwing things, shouting, belladonna, stramonium, HomoeoSeminar, जो आपने बोला ना. But why we will choose stramonium? So you have to have a comparative studies. Yes? आपको कुछ कहना है? Okay. So stramonium has more, and so far I have verified in my practice. Belladonna patients in casualties समझता है. I have a patient of belladonna and lycinum. They are almost attacking on physician. उनको बांध के रखना पड़ता है. Lysinum patient to almost was as if going to bite. My student recording है, अपने पास इतना time नहीं है. When I take workshop for mental health, I show that case where student feels as if मुझे आके वो bite करेगा. जानवर मेरे पे कूदा था. So that was lysinum. This is belladonna where there is aggression, which is outward toward the others. And veratrum is also a different type of grandiosity, and they come with religious preaching, and they come with as if they are big king. While stramonium has a fright and fear, and their डर से आप डरते हो. So stramonium was given in this case 200. Stramonium, when you study in Materia Medica, very interesting theme now. Stramonium presents state where person feels alone in dangerous world. Are you seeing now correlate with this case? Abandoned without support, correlate with this case. This is theme of Materia Medica. Huh? Surrounded by threatening forces, correlate with this case. Inner experience of intense fear with violent reactivity. This is stramonium. So you can differentiate these remedies closely coming up. And I am alone in terrifying world and must fight for my survival. So this is how the theme of stramonium matches with the theme of the case also. पुडिंग का सबसे अच्छा पार्ट रहता है कि खा के देखो टेस्ट कैसा है. हाँ, तो देखेंगे हम. Now after one dose, I have given it when I came in hospital. After half an hour, I am meeting her. ये आवाज थोड़ा कम करो. वॉइस थोड़ा ऊंचा करो. Observe what I am doing with her. Huh?
थोड़ा घूमने लेके जाओ नीचे.
इन्हें फरवा ले जाओ.
कोई नहीं भागेगी. उसको मालूम है यहाँ कोई उसको तकलीफ नहीं देने वाला है. क्यों भागेगी? भागेगी तो उसको तकलीफ ज्यादा है बाहर. चंदा देवी भागना नहीं, मैं तुझे बाहर भेज रहा हूँ घूमने. ठीक है, घूम के वापस इधर आना है आपको, और हम अच्छी सी दवा देंगे. चंदा देवी ठीक हो जाएगी और मम्मी के घर जाएगी नेपाल. चंदा देवी को कोई भी तकलीफ है तो यहां चले आना है. ठीक है, चंदा देवी अभी बाहर गार्डन में घूमने जाएगी. पीछे अच्छा गार्डन है, घूम के आओ, मन अच्छा लगेगा. अंदर बेचैन हो जाती है. अभी तो अच्छी हो गई है, गुस्सा कम हो गया है. और आने के बाद थोड़ा नहा लेने का गर्म पानी से अच्छे से. हाँ, मौसी को बोलता हूँ गरम पानी से मिलाने का हूँ, पहले घूम के लेके आओ.
What I have done, please be interactive. What I have done, खाली होम्योपैथी दवा से नहीं होने वाला है कुछ. This is called positive reaffirmations. आपने उसको शांत देखा, आपने उसको अच्छा बोला. अब तक लोग उसको क्या बोलते हैं? पगली है, पागल है, यही सुनता है ना सोसाइटी में. अच्छा हुआ किसी ने पत्थर नहीं मारा, नहीं तो पत्थर भी मारते. सो यू गिव हर अ डिग्निटी, यू गिव हर अफर्मेशन, एंड यू गिव हर अ फ्रीडम. आई एम नॉट हियर टू कैच यू, आई एम फ्रीइंग यू. गार्डन मीन्स व्हाट? छोड़ रहा हूं. मेरा स्टूडेंट मुझे बोलती सर लेकिन भाग जाएगी. मैं उसको कुछ कह रहा हूं, लेकिन मैंने 2 वॉचमैन खड़ा कर दिया था गार्डन के बाहर कि वो कहीं भी भागे तो पकड़ के लेके आना. बट what I am talking to her is very important, because this is rebuilding her mental health. This is the right time in homeopathy. Hahnemann says when remedy acts, the lucid phase comes, and in this lucid phase your each word is a golden word for them. When she is mad and I am talking, the same thing will have no effect. Are you with me? See what happens next. She's been taken out and she tells a story. after 2-3 doses of stramonium. Immediately तो नहीं गई थी, थोड़ा टाइम के बाद in evening she went out. We have a small garden behind hospital, and each homeopathic hospital should have this facility. So this is how the progress took place. What she talked in garden, I'll tell you now. This is the story. ये internet भी interesting है. I gave the story and I asked for the picture and I got the exact picture. ये आप लोगों के लिए, नए जनरेशन के लिए तो मस्त है. When I liked it exactly, she's looking for a baby, she's traumatized, she comes from an earthquake prone region. So the whole process is lonely, forsaken feeling, early quick marriage without consent, from hills of Nepal to here, feeling alone, feeling forsaken, and she was pretty disturbed, unsupported. So another de-packing constitutional remedy. Anyone? Anyone guess? देखा होगा तो ठीक है, क्विक है आप लोग. मैग्नीशिया म्यूरेटिकम, McCarp, Netramur, these are closely coming up remedy. She is a hot patient. She had another concomitants which were fitting into magnesium muraticum. So we have opted for Magmur single dose and see what happens with Magmur. Is the same lady? Okay, look at it.
कैसे लग रहा है? कैसे लग रहा है?
Suno, wait. Look at all observation in follow-up. She is saying that leg is painful.
कब से कर रहे हैं?
पहले से कैसा लग रहा है? क्या अच्छा लग रहा है?
किसमें ठीक लग रहा है? हाँ, पर ठीक मतलब इधर से ठीक, कौन सा ठीक?
ठीक. घर का काम करती है, खाना बनाती है, खुद बनाती है. वेरी गुड. और कोई तकलीफ है घर में? नहीं. नींद ठीक से आती है तुझे? ओके. व्हाट आर द अदर कंप्लेंट्स यू डू अपार्ट फ्रॉम दैट?
रोना,
एक गुस्सा आ रहा था तुझे, वो आता है अभी? कोई चिंता नहीं, ऐसा होता है, सबको होता है. लेकिन कुछ याद, तुझे हिंदी समझता है मेरा बेटा? हिंदी नहीं समझता है, नेपाली समझता है. मैंने बताया था नेपाल जाएंगे, जाना है, घर जाना है. हाँ, उनको बोला तूने घर ले जाओ. तुझे बॉम्बे अच्छा नहीं लगता? आइए. कितना फर्क लग रहा है पहले से? क्या क्या फर्क लग रहा है?
ठीक है बोले.
यानी बोली वचन ठीक है.
सारे मोहल्ला पूरा नहीं करते हैं.
हाँ.
खाना खा रहे हैं, सो रहे हैं.
अच्छा. और खाना बनाती है खुद?
हाँ, बना सब.
अभी बनाना
आवाज बड़ा कर.
यानी जवाबदारी पूरा ले रही है अभी.
हम बिल्कुल एकदम हो गए.
उम्मीद ही नहीं कि वो ठीक. यानी क्या हो रहा था, क्या देखा था आपने?
शैतान ऐसे है सर, किसी को देख किसी जाना, शैतानपना करना, कपड़ा फाड़ना, भागना रोड में, फिर किसी को कैसे कंट्रोल करेगा इस तरह की लोग. सर हम सोचा कि क्या हमारा किस्मत हो गया, कैसे क्या हो गया. मैं तो हम लोग गलती कर दिए बेकार में. क्या मुंबई में हालत ही खराब हो गया. आते अभी तो नए गाँव से आया, एक साल शादी का हुआ. बच्चे का तो कोई मतलब ही नहीं है. कितना दिन लगेगा, क्या लगेगा, वो मतलब टेंशन हमको है ही नहीं. क्या जरूरत है, इतना ही बच्चे से बच्चा चाहिए हमको अभी. तो हम लोग बहुत परेशान हैं. आप लोग की दुआ से जो है अभी बहुत है. आई एम वेरी हैप्पी सर, नो प्रॉब्लम.
थैंक यू.
And the best part of homeopathic result, best part. Do we have any time seen psychiatric patient admitting themselves in hospital? हाँ, सुना है कि साइकेट्रिक पेशेंट बोलेगा कि मैं हॉस्पिटल जाऊं, डॉक्टर मुझे एडमिट करो. This is the other case. I'll share with you quickly similar type of case. In this case, she came regularly. She was looking forward to that young doctor, wanted to meet. और क्या एक वर्ड उसने बोला, ये मेरे मां का घर है, मैकू. And for this female, homeopathic mental hospital is मां का घर. And that is what we are saying Hahnemann must be saluting from the heaven, rapid, gentle and permanent. It is not a theory, it is an experience. And I had such very bad case, more bad than her. And this patient is better. Again in same case also Magmur was there, and if someone reads Magmur from Edward Whitman's book, Psyche and Substance, if someone is interested in reading, Psyche and Substance by Edward Whitman, and he talks about Magmur and psychiatry. And so many of his cases were magnesiums, Magcarb, Magmur, Magsulf, and Natrum. So these are the Natrum and Mag salt, he says, that has something that they heal these deep-seated conflicts. So that patient, after treatment was done, 6 months she has not come. Suddenly one day I get call that आशा है ना वो एडमिट हो गई है. बोला क्या हुआ? बोलते हैं नहीं, she didn't went to casualty, she didn't went to OPD, she went to IPD. IPD जाके she told that doctor that I want to get admitted because I feel some symptoms are coming back. And she gets admitted. We give her, in that case was also Magmur 200 was given, Magmur 1M, 1 dose was given. She slept for more than 2 days. और मैंने बोला उसको छुओ मत, कुछ भी मत करो. She went on sleeping after Magmur 1M for more than 2 days. And she gets up, she says I am okay, and she is going. Friends, this is not every day happening. This is our long struggle. 8 में से 2 या 3 लोग ऐसी खुशी देते हैं, बाकी के अंदर केसेस में हम सर्च करते रहते हैं. But there is a lot of hope from these cases that if we can do something for them, we can do everything for everyone. So what are we doing? Each homeopath is mental health clinic. Each homeopathic clinic. So learn psychology, learn fundamentals of psychology, and luckily NCH has now taken up challenge, and first year onward psychology study is there. It's there in new syllabus, right? So my learning is this aspect. Observations are very important. I have cases and cases which is 1 hour, 2 hours long interviews, but I have brought to you acute condition. Chronic treatments are slightly different, which I told you about this case, taken the long details, which is another art and skill. So we are running one mental health workshops online. So anyone who is interested, please let us know. You can put up my email ID, drpatelmanoj@gmail.com. Simple hai. drpatelmanoj@gmail.com. And you can say that, sir, I'm interested in that workshop. I'll enroll. It's very just registration fees are there. Okay, so you can understand and learn about mental health. There are good publications. And these are the conditions which we are treating at Palghar. So many different condition visits to us in our OPD and IPD. This is our IPD. I have so many cases of alcohol de-addiction and withdrawal, acute alcohol. And friends, first 3-4 years, no allopathic doctor allowed us to touch in our own hospital, because they said that 20 to 30% people die because of the convulsion. 20 to 30% people die in alcoholic convulsion, in withdrawal state. So they said, okay, no, we can't give you these cases. But 2 or 3 cases we produced result. The story changed. Now that allopathic consultant first call, जैसे ही उनको फोन आता है तो बोलते पहले बोलो डॉक्टर साइकेट्री डिपार्टमेंट को बोलो ट्रीट करे, and then I will get involved. So this is how you can change allopathic mindset also by results. It took long journey for us to convince them that give us chance. And this is the book. आप लोगों में से किसी ने खरीदा है कि नहीं ये book? This is the book which Dr. Kumar Dhawale and team, which including I have written 2 chapters here. The group of doctors have written. This is excellent book for fundamental of psychology and homeopathy. Must book for everyone who are student right now and even for practitioners. Okay, this is the book I have personally written in how to explore in long cases mind. I created a model called TFCR, thinking, feeling, car. Each case, if student says that mind is not available to me, I cannot explore mind. This book will guide you and help you to open up any patient, even if they are reserved or non-reserved. They will be learning to talk. So this book gives you skills which I learned from my teacher, that how to open up various patients. Thank you very much to Dr. Kalpi, Dean. Thank you very much to company. Thank you for listening. For the teachers, we have a different workshops. So those teachers are also interested. There is called Yash course. And in that Yash course, we are going to give you at very, very nominal rate, just registration fees, how to teach this subject to first year students. So any organon teacher who are teaching psychology can register on this course. We have to just put up one mail to me that I am interested and we'll do needful for them. Are you with me?